All right. Hello, my name is Kenta Schott. I am a PhD candidate at Arizona State University. I'm going to talk to you guys a little bit about postpartum fitness and kind of how to prepare yourselves to get back into that PRT test, the physical readiness test. Okay, so at the end of this presentation, you should be able to understand the differences between a C-section and a vaginal birth and kind of how their recoveries are different. You should be able to understand the common activities of daily living with newborns, and why and how they can lead to physical imbalances, and then how to avoid them. You should also be able to understand some of the factors of the physical readiness test and what exercises can be added into your routine that can help to improve your score. And then before we get started, as a precaution, before you start participating in any type of physical activity or exercise program, you should be making sure that you have been cleared by your primary medical provider. So whether that's your PCP or your OBGYN, whoever your primary is, that's who needs to be saying, yep, you're good to go. You can start with exercise again. And then as a general reminder, this is not an educational model for caring for an infant. It's an educational model on how, for you as a mom, how you can return safely back into physical activity after giving. So a general timeline, after birth, you typically have your 6-week checkup. And in most cases, this is where your medical provider is going to be clearing you to return to physical activities. About 3 months, most women feel comfortable adding in more intense exercise and movements. At 6 months, we would like to be shooting to incorporate some of the PRT movements into our training to help prepare. And then by 12 months, we need to be ready to take our PRT again. So for the first 6 weeks, the main goal here is just to be present. It is not to focus on returning to activity. It is to be present with your child, right? Take time to care for yourself, and this new life that you are solely responsible for, or with you and your partner or family, whoever is helping, if there's someone helping you, right? Taking the time to really just be present in this moment, because it's new, right? You're learning how to navigate your life with this new being that is dependent on you. And just making sure that we're taking time also not only to care for this infant, but also for yourselves. If that means you give your infant to someone to care for 10 minutes so you can shower and just take a moment to yourself, right? So really making sure that we are carving out time for ourselves, as well as learning how to navigate with this new being. During this phase, we are going to see lots of physiological changes. We're going to see blood volume changes. We're going to see a lot of genitourinary recovery. So birth, as beautiful as it is traumatic, right? We are either we are having a whole body removed from us, whether that be via a C-section or a vaginal birth. It's traumatic for the mom's body. So we're going to see a lot of recovery in this timeline. We're going to see some metabolism changes as a result of hormonal changes, and that is also going to affect our emotions, right? So we're going to see a lot of changes through this time, and understanding that returning to exercise is not going to be a one size fits all. So some moms are going to have a really easy time getting back into exercise, and some it's going to take longer. It's going to be more difficult. And just knowing that that's okay, right? It's not a one size fits all. Approach it on your personal timeline. Do not approach it based off of someone else's experience or someone else's expected timeline. Typically, exercise isn't recommended until After this phase, however, sometimes your PCP and yourself may have that open conversation and decide that safer, lower impact exercises like walking or treading water, things like that, may be safe for you to start as early as 4 weeks. Okay, so the different birth types. So we have two main birth types, right? Either vaginal or C-section. And typically after a vaginal birth, you're going to be cleared around 6 weeks. Between 6 and 16 weeks, that's when we're going to see our hormones starting to kind of return to our normal homeostatic levels. And like I said, with vaginal births, some women are able to return to physical activity as soon as days after birth. But again, it's going to be variant depending on the mom, the previous training, and just general status, right? There's lots of different factors that are going to affect how quickly you as a mom are ready to return to physical activity. As for cesarean section, this is a much more invasive procedure, right? We actually have to cut open the lower body and remove the child from the placenta. Typically, your doctor is going to clear you for physical activity about 8 weeks after birth, so 2 additional weeks typically as compared to the vaginal birth. But again, the clearance is going to be very dependent upon the mom. And then any type of complications during birth always are going to require consultation and open conversation with your primary care doctor before you return to physical activity. So between the weeks from birth on to 6 weeks, there are some movements and exercises that are generally safe to perform even without that official clearance. So light stretching of the neck, shoulders, arms, and legs generally are okay and safe to do. Things you want to avoid are going to be any type of stretching through the abdominals. So avoiding the cobra poses or any type of prone positions, especially if you had a C-section. Low impact cardio, including walking, is generally safe to do. And then making sure that we are always practicing good posture. So if we're finding ourselves sitting, making sure that we are focusing on sitting upright with a straight spine. And you want to think almost pull your shoulders down and back to open up that chest. And then if you had a catheter placed, you can safely return to adding those pelvic floor exercises after that catheter has been removed. Obviously, any pain at all, we should be avoiding. So if you do any of these movements and there's pain, stop immediately. If it is extreme pain, definitely consider calling or contacting your PCP. And in general, the exercises on the right side of this slide are going to want to be avoided. So any type of core crunching or kind of movement through that core. So sit-ups, crunches, planks, leg raises, bicycle crunches, those are all going to want to be avoided. Any type of jumping or plyometric movements, sprinting and running, so any type of heavy impact you want to avoid, right? Because our genital area is, again, has been through trauma. And so we're trying to allow that healing. And so we don't want to have a whole lot of impact down there. Again, any type of exercise that puts pressure on the scar or induces pain should be avoided. So after your 6-week checkup or being cleared by your medical doctor for physical activity, your goals are going to want to be beginning light cardio training and avoiding imbalances. And then we are going to want to focus on regaining our core stability. So cardio-wise, you're going to want to start to add in between 15 and 30 minutes of continuous exercise. You can do that up to 2 to 3 times a week. Your RPE, so your rating of perceived exertion, is the best way to kind of gauge how intense we are going. And you want that to feel like about a 5 out of 10. And then some people in the training community refer to that as a zone 2 cardio training. So you don't want to go any more intense than a zone 2 or a 5 out of 10 on that RPE. And some modalities that we can use are walking, we can swim, we can do water aerobics and elliptical. Notice how all of those are very low impact. Now, biking is asterisk because, again, we have that trauma in the genital area. And so sometimes sitting on a bike seat, it can be painful. You can have stitches, swelling, or bruising, right? We can have some of that sensitivity down there. And so biking is not always recommended. However, if it's comfortable for you, by all means do it. Okay, so let's talk about the activities of daily living that can commonly cause physical imbalances. So if you do find yourself hip holding, so holding that baby on your hip with a curve in your spine, you're going to want to make sure that we are periodically switching from side to side, or like shown in that video, photo in the top right, try using a baby carrier, right? So that's going to help us keep the side to side movement to a minimum. If we're finding ourselves sitting for long periods of time, so like me, I sit at the computer a lot, right? Try taking breaks every half hour or approaching the work to rest ratio of 25 to 5. So you sit for 25 minutes and you get your work done for 25 minutes, and then you have a timer and you get 5 minutes to get up, walk around, go to the bathroom, get water, do whatever you need to do, get some movement, maybe stretch a little bit, right? So you get that 25 minutes to 5 minutes of rest. And then other resting positions, instead of sitting, we can try sitting in child's pose. So pulling those hips back over the feet, stretching our arms up overhead, just opening up that chest and those hips, allowing some movement that isn't just sitting. Lumbar lordosis. So after pregnancy, you are predisposed to having this this pelvic tilt. And so what you want to think is take your tailbone and tuck it underneath you, right? So we as women after pregnancy, we are predisposed because our core has been just obliterated, right? We've worked so hard. We may have stretching, we may have some diastasis recti, which I'll cover in just a minute. And so we are predisposed to having that lordosis. And one way to counteract that is, again, to take our tailbone and think, tuck it up and underneath, and actively engage the core. Again, avoiding hip holding if possible. So using a baby carry is a great option, and practicing those pelvic tilts while standing. So when you're feeding your baby or making your meal or making your baby's formula, taking that tailbone while you're standing, again, tucking it under, engaging the core. So diastasis recti is essentially, for lack of better terms, a split in the core or the abdominal muscles. And a couple of exercises that we can use to help to kind of repair those is pelvic tilts. So again, pulling that tailbone down and under. We can do cat-cow pose. We can do belly breathing, happy baby. Braced single leg extensions are great. Braced marches and dead bugs. All of these exercises, if you don't know what they are, they can actually be found in the exercise library on the same YouTube page that you found this video. So after 3 months, your goals are going to be starting to increase in intensity. So we're going to want to start to incorporate higher impact, higher intensity aerobic training. We're going to start including some resistance training, and again, continuing to really focus on that core stability and strength. So as for increasing your aerobic training, we're going to want to be looking at increasing the total amount of time that we are doing this aerobic activity, and increasing your run to walk time ratio. So this guideline is aimed at getting you prepared for the PRT, which includes a 1.5-mile run. And so we are going to really be focusing on running over something like a bike or a swim, right? And those aerobic activities are great, and they will help improve your run time as well. But we are going to be focusing mostly on running right now. And then we're going to be looking at speed as well. So if we're able to run for longer periods of times, we're going to look at increasing our maintained speed during longer runs, right? Or increasing our top end speed, so our sprint. So we can increase our run to walk ratio by slowly increasing the amount of time that you are running in comparison to the time that you are walking. So the visual on the right side is just a sample of exercise for kind of a guideline to increase the amount of time you're able to run. So during week 1, let's say you can walk with no problem for 30 minutes straight, right? No breaks, none at all. Week 2, you can try 3 rounds of walking for 9 minutes and then jogging for 1 minute, and then a cool down of 5 minutes at the back end. And then week 3, you'll go from that 9 to 1 to now an 8 to 2, and then 7 to 3, and then 6 to 4, and then 5 to 5. And then we'll back off a little bit, and then we'll start it again, right? So the aim is just to incrementally increase the amount of time that you are running in comparison to the time that you are walking. If you're able to run 1.5 miles straight without walking, then you can take this same setup and approach it with a run to more intense run, right? So we can go from jogging for 9 minutes to sprinting for 1 minute, or running, right? A little bit more intense for that 1 minute. It's going to help to increase the amount of time that we are able to run at that higher intensity. Okay, so resistance training. Most women in the situation that you guys are in have some previous training history. And so the approach for this is going to be shooting for incorporating 2 days of upper body per week, 2 days of lower body per week, and then core stability and balance between 5 and 7 days per week. So let's talk about it. All right, so each day, again, we're going to do lower body exercises 2 days per week, upper body 2 days per week, and then core and balance 5 to 7. So let's say you have a lower body day. You're going to pick between 3 and 5 of these exercises, and you're going to go 1 to 3 sets of 8 to 12 reps. So let's say one day I choose to do the leg press, the lunge, and an RDL. All right. I'm going to do 1 to 3 sets of those with 8 to 12 reps on each of them. And then the second day is upper body. So I choose chest press, overhead press, tricep press, right? So I do those 3, and then I do 1 to 3 sets at 8 to 12 reps. My second lower body day, I'm going to choose different exercises that I chose from the first day. All right. So we don't ever want to do the same 3 exercises every single time we do lower body, right? Because different exercises work different muscles. So we want to make sure that we are incorporating a variance of types of exercises that we're including. And that's just going to, again, help to minimize any type of imbalances. Again, all of these exercises, if you don't know what they are, or have never seen them, or don't know how to do them properly, you can find those in the exercise library on this same YouTube channel. All right, so time to prep for the PRT. Approximately 6 months after birth, we are going to start to look at continuing to increase the aerobic training intensity. We're going to look at increasing resistance training intensity. And again, we are still always going to be focusing on our core stability, strength, and balance. All right, so our main components of the PRT is going to be including muscular strength. So that test is going to be 1 minute of push-ups or 2 minutes of hand release push-ups. We're going to look at 1 minute of sit-ups or 2 minutes of cross-legged reverse crunches or a timed forearm plank. And then our cardio test, which is a 1.5 mile run, a 20-meter high aerobic multi-shuttle run, or the 2-kilometer walk, if not medically cleared to run. So that 2-kilometer walk is only if medically you've been allowed to perform it, right? Everyone else is going to have to do the 1.5 or the 20 meter. All right. So again, we're still looking to get that 1.5 miles without rest. And if you are able to get it without rest, the goal for you is going to be increasing your maintained run speed. So we're going to look at increasing the intensity of the 1.5 mile run. Now, if we have to take breaks during this 1.5 mile run, our goal is just going to be to get to the point where we can run this 1.5 miles without taking walk breaks. And once we get to that 1.5 without taking breaks, then we'll go up to that top goal of increasing the maintained speed during that 1.5 mile run. So these are your scores as of 2024 for the aerobic testing. And at staying within these scores at these age ranges, these are going to keep you in that low risk category. So making sure that we are understanding what these mean and kind of what pace we really need to be keeping. All right, as for speed progression, there are a few ways that we can add in speed work to help improve our run time. So any general guidelines for any type of workout at all, we should always be adding a warm-up for at least 5 minutes, including dynamic stretches and easy jogging or walking laps. And then we should always be cooling down, kind of mimicking our warm-up. So a nice, cool, low intensity jog and some stretching. And then you always want to limit the number of speed workouts that you do each week, because if we are constantly doing speed workouts, we are going to essentially be increasing our risk of overtraining. And so we really shouldn't be doing more than 1 to 2 each week, right? So some workout ideas would be a HIIT type training. So that would be coming out to the track and doing 1.5 miles in total. And what you do is you sprint your straight and you jog or walk on the curves of the track. That's a great way to have a high intensity interval type training exercise and still shooting for that 1.5 mile. You can also do 400-meter repeats. So that's going to be 1 full lap on the track. And you're going to do 3 to 5 at 400 meters. So 3 to 5 laps in total at a fast pace. So you're really trying to push your pace when you're running these 400 meters. And then however long it takes you to do this 400 meter, you should be resting for at least that much time. So let's say it takes you 1.5 minutes to run a 400. You get to the end, you should be resting before you do your second for at least 1.5 minutes. All right. If that means if you get to the end of that 1.5 minutes, you're like, I still need more time, take more time. All right. And as you get better trained, you're going to be able to cut down. But at this, when we're doing as fast as possible, we should always be resting for at least as much time as we're working. And then fartlek runs. So fartlek runs can be structured or unstructured. And essentially, it's just a run, walk, jog, sprint, kind of, for lack of a better description, willy-nilly, right? So you can take off on a jog and then, oh, there's a stop sign ahead of me. I'm gonna sprint from this stop sign to that tree. All right. I sprint. And now I'm tired. So now I'm gonna walk. All right. Or you can use your music that you're listening to. So you hear a bass drop and you decide, oh, I'm gonna sprint during this drop. And then I'm going to use the chorus to recover, right? So it can be structured or unstructured. So you can have it be timed. And so you run for 30 seconds and then you walk for 45 and then you sprint for 10, right? It can be structured or totally unstructured using things like stop signs and music and things like that. All right, so intensity for resistance training. During this time, you're still going to want to be increasing the intensity to help gear up for this test. And then the exercises during this time point are going to be a little bit more intense, a little bit more difficult, including more compound movements and free weight exercises. So some of the exercises are included here. And again, all of these exercises can be found in the exercise library. And so similar to how we had it set up earlier, to upper body to lower body, and then 5 to 7 days of core and balance. And so instead of that 1 to 3, we're gonna be looking at choosing 5 to 6 of these exercises each day and performing 4 sets, including 5 to 6 reps. All right. So we are increasing the volume, and we are also increasing the actual intensity and the RPE, so the perceived exertion of them, right? Making sure that we are always including some rest in between each set. That is just going to allow us to safely progress through these exercises. And again, avoiding choosing the same exercises every single time you go to the gym, as all of these exercises kind of target different muscle groups. All right, so here's kind of a sample training week plan. Obviously, if this doesn't work for you, it can be modified, but I figured I would just provide you with kind of a skeleton, as you will, in case you like having some kind of structure. So on Monday, we can do a full body workout. On Tuesday, we can do a speed workout. So that's our one speed workout of the day. Then Wednesday, we're going to do a lower body workout. Thursday, we'll do another run, but it'll be a nice low intensity jog or run. Then we'll do upper body on Friday. And then we have a long run on Saturday. So anytime we do a long run, it's going to be for explaining this. So there is no set distance for that easy 30-minute run. And so let's say during that 30 minutes, I run 1.5 miles or 2 miles. I'm going to take that 2 miles, and for my Saturday run, I'm going to multiply that by 1.25 or 1.5. And that's going to give me how long I can run for my long distance run, right? And then always, always, always incorporating at least one rest day per week. This setup is going to be more on the intense side, right? So going from no exercise at all to exercising 6 days per week is a big jump, right? So if it means, if this is too extreme, cut it down, right? Take 3 of these exercises. So maybe we do the full body workout, and then we do the 30-minute run, and then we do the long run, or maybe we do the full body workout and then we move that speed workout to Wednesday, and we do the speed workout on Wednesday, and then we do an easy 30-minute run on Saturday, right? So we can pick and choose kind of what we're doing based on how we're feeling. So a few different or a few important notes for you as new parents. Let's talk about parental leave. So depending on your circumstances of birth, the amount of time you're given is going to be dependent upon that. So making sure that we are reviewing these codes before so that we're understanding what our rights as parents are. As for the PFA testing, service members are prohibited from participating in physical fitness during pregnancy, but they are encouraged to stay active during pregnancy. So if you haven't yet, please go watch the pregnancy nutrition and fitness resource that is on this YouTube page. That's going to help kind of give you some ideas for how to stay active during pregnancy. And then post-pregnancy PFA for pregnancy lasting longer than 20 weeks is going to be, you must return and take your PRT before the 13th month after delivery. So 13 months after you give birth, you have to take the PRT again. Any type of pregnancy lasting less than 20 weeks is going to require a medical provider decision on how soon that PRT needs to be taken. And then as for lactation, it is required that commanders and supervisors provide a reasonable break time for at least 1 year postpartum to allow for pumping or feeding, right? And the amount of time is variant depending upon the mother and the baby. And so just making sure that you as a mom are advocating for yourself and saying, I need more than 3 minutes to do this, or I need more than 5 minutes to do this, and just making sure that we are advocating for ourselves, right? And then it is recommended that somewhere between 15 and 30 minutes every 3 to 4 hours, pumping is recommended, especially if you are breastfeeding. And then, so there are lactation maps. So there are spots on your base that are allowed, like you can take yourself there, you can pump in private. It is a comfortable space that is for you to do this activity in a comfortable private area. So making sure that you're checking out the lactation map to identify those locations. And then some general exercise guidelines specifically for uncomplicated deliveries. Like I said in one of the first slides, any type of complication incurred during pregnancy or birth you should always consult your doctor prior to starting exercise. However, during uncomplicated deliveries, there are some general exercise guidelines that we can provide. And so typically, stretching, pelvic floor exercises, and breathing exercises are safe to perform immediately after postpartum. Newborns can be taken for a walk in either a stroller or, if you're able to, carry them, right? So that is perfectly safe, is to take your baby for a walk. In general, please don't rush the introduction of exercise or getting back into shape. That is, like I said earlier, this is on your timeline, right? It is not a mandated 6 weeks, you have to be doing this, or at 3 months, you have to be doing this, right? This is very individualized, and you really need to take it upon yourself to recognize how you're feeling and how intense and how hard you can push yourself. In general, after birth, we should not be using our fatigue as a guide for participation. We should be using how hard we feel like we're working, right? So we don't want to overly fatigue ourselves, because we went through a very traumatic experience. And so we are wanting to use those rest intervals, use the perceived exertion scale to gauge how intense we are going. Always reintroducing abdominal exercises slowly and avoiding torque exercises. So anything that you twist with resistance should be avoided until fully healed and much more structurally sound in the core. So usually that's not recommended until at least 8 to 10 months after birth. And then always maintaining proper nutrition and hydration for general health. And then beginning any type of moderate intensity aerobic exercise program should always be delayed until after the first 6-week postpartum checkup. So here are some references if you would like to learn a little bit more about some of the exercise that you can do, or just kind of different delivery types, or just general exercise information. Congratulations. I hope you have a wonderful experience and the best of luck returning to physical activity. And again, congratulations.